Hi, students. We're going to start here on Chapter 5, Legal Aspects of Health Information and Reimbursement. So once again, go ahead and look through your chapter objectives, and we will look at record retention, sources of law, audits, HIPAA legislation. So let's go ahead and start with that check that activity 5.1. So what legal regulatory terms are you as a student most familiar with as you begin learning the content of this chapter? So just kind of think of it. Which laws or regulations that impact health insurance processing can you easily explain? Here's a great hint. Review the list of key terms at the beginning of the chapter. Select legal regulatory items that you can define, and then any laws and regulations that you can explain. This will help you out with it. So once again, go ahead and look at the answer. And here they give you a nice little tip. Use flashcards, writing your key terms on one side, flip them over, definitions on the reverse. I would always tell students to even do this in medical terminology. It helped the student learn things quicker, memorize things, and hopefully relate to it in a critical thinking way also. So here are overview of laws and regulations. So a couple of different things. What does CMS mean? This is the Center for Medicaid and Medicare systems. We have Medicare Administrative Contractor, conditions of participation, which we will talk about. Conditions of participation really basically is around Medicare. Okay, so we'll get into that. So once again, CMS, I just talked about that. It is Center of Medicare and Medicaid Services. It is a part of the Department of Health and Human Services. So, what is the topic of this transmittal? Goes through it, and it is the ICD-10 and just other national coverage determination is the topic of this CMS transmittal. Federal laws and events that affect healthcare. We have a knowledge check again. So go ahead and look through this. I'm not going to go through each one of your knowledge checks because they're really self-explanatory. Let's talk about retention of records. Storage of documentations for an established period of time. This is mandated by federal and or state law. The purpose is to ensure availability of records for use by government agencies and other third parties. So CMS and HIPAA mandate that the retention of records. Now this could be different from every different area. Just like here, South Dakota, they must be retained until records have become inactive for patients for whom the whereabouts are unknown to the physician. Thus, a medical practice in South Dakota must retain patient records for 6 years. Every state is going to be different. So just a little check your knowledge, check to see what Iowa is. One thing you want to make sure when retention, a couple of different things. At Medical Associates, they have a warehouse with so many paper records in there. So if anybody doing their practicum or their clinical at Medical Associates, the answer or a question for them is how long do they retain their medical records? Keep in mind, after maturity is age 18. So if they haven't seen that patient since they've been 12, let's say their retention's 5 years, they still have to keep that record till the patient is 18. Then, if it's 5 years, then they have to wait 5 years after they turn 18 to destroy that medical record. Okay, so we have healthcare audit compliance programs. What this does is ensures integrity of the government health programs by combating fraud, waste, abuse, finding, correcting improper payments. So different things, it detects inappropriate codes, and we will get into coding, like I said, in a couple of weeks. You have different compliance programs. So they will make sure that your physician is billing correctly, that they're not overbilling or underbilling. They make sure that services are reasonable and necessary. They also make sure that there's proper documentation, avoiding improper inducement kickback and self referrals. So, when I say self referrals, let's say we have an internal medicine doctor who has a patient whose ankle's hurting. But really, is that an orthopedic? If every aspect of that is taken care of, do they need to refer them to an orthopedic? Or do they do their own, let's try this before we refer you? Medicare Integrity Program, this is by HIPAA mandated, and we are looking at fraud and abuse. So I want everybody to look at the definitions for fraud and abuse. These are very important for medical assistants to know. Let's look at the difference between fraud and abuse. Fraud is the intentional deception to secure unfair or unlawful gain, to deprive a victim of legal right. It's estimated that nearly $60 billion are lost annually due to healthcare fraud and abuse. So let's just look at different examples of healthcare fraud. So, misrepresentation of the type or level of service provided. So, this would mean that if a patient came into the office, and let's just say you are the medical assistant at that case, and the doctor spent maybe 15 minutes with this patient, but billed the highest level of service to get more money, that is fraud. Also, billing items and services that have not been rendered, such as billing them, let's say somebody came in with, once again, that sore ankle, and instead of giving them a splint, they bill them for one. Billing for services that have not been properly documented, billing for things that are not medically necessary. So let's go to abuse. Abuse is defined as practices that are inconsistent with accepted sound fiscal, business, or medical practices and result in unnecessary cost. So this would be misusing codes on a claim, charging excessively for service or supplies. So let's go back to that splint. Let's say you did give that patient a splint, but what we're talking about is abuse is adding an extra $20 to it, billing for services that were not medically necessary. And that could be anything saying with, once again, that sore ankle, that they send them to physical therapy. Okay, that wasn't really medically necessary. So both fraud and abuse can expose a provider or vendor to criminal and civil liability. So we will get more into fraud and abuse as we go on into, okay, let's get back to the PowerPoint. We have Recovery Audit Contractor Program. With this, you will hear the word RAC. It's called RAC. And what this does, these are different contractors that contract with Medicare, and they go into hospitals or possibly clinics, and they audit their billing. So they take documentation from, let's say, a visit or an admission, and they audit it. And if they feel that what that patient, there isn't enough documentation to support what that physician charged, they will go back at the hospital to get that money back. Same thing for a clinic. So, as you can see, Iowa here is in Region 2. So we have different auditors that actually come in and audit for Medicare to try to get reimbursement back from hospitals that possibly could be overcharging, or for clinics that possibly could be overcharging. Then you have your Healthcare Fraud Prevention Enforcement Action Team, Medicare Shared Savings Program, Reducing Overpayments Program. So there's a lot of different programs that are out to help Medicare. National Correct Coding Initiative Program. This just makes sure that places or facilities are correcting appropriate. Okay, knowledge check activity 5.5. What are the ways you can think of healthcare audit and compliant programs ensure the integrity and financial liability of government health programs? Okay, so right here, this is a great answer. Combating fraud, waste, and abuse, improper payments, correcting them, coordinating intelligence, sharing among investigators, agents, prosecutors, facilitating sorry, facilitating coordination and cooperation among providers to improve quality of care, and detecting inappropriate codes. Okay, so then we get into HIPAA. What is HIPAA all about? I'm sure you've heard about it a lot. It was developed back in 1996 under President Clinton, the Federal False Claims Act, which provides the CMS, remember, the Center for Medicare and Medicaid Services, with authority to enforce fraud and abuse. So with that of 1986, we want to look at to make sure the continuity of health insurance coverage in group and individual markets, combat waste and fraud and abuse, promote use of medical savings account, improve access to long-term care services, simplify administration of health insurance, create standards for electronic health information, create privacy and security for health information. Here's just a nice little graph here for you to look at. Okay, examples of HIPAA fraud and what are the consequences. What I would do, this is a great slide for fraud and abuse. So right here is everything for fraud. So this would be a doctor accepting bribes. That's fraud. Or altering claims to increase reimbursement. Billing for services supplied, not provided. So some of these I went through when I pulled up what fraud and abuse were. So keep this slide on your mind to come back to. Okay, self-assessment. Right here, what are the patient retention laws in your state? What legislation do you believe has the most significant impact on health insurance? How has HIPAA changed access to health insurance and prevention of fraud and abuse? What is the major difference between HIPAA security, rule, and privacy? So with that, then we end up with our summary. Okay, so now what I want to do is go ahead and just look at your assignment. Okay, with the assignment's 30 points, please visit the NCQA website. If you click on that, you should be able to answer the following questions. Click on HIDUS. I will go to that here in a minute. And at that point, choose a domain, expand on it so you can see the measures under that domain. Are there any unfamiliar measures under your chosen domain? If so, please list them for us. If not, think of a measure you wish were under your chosen domain that is not. And then select one measure, click on it to see the details behind the measure. Tell us which measure you choose to look at and which healthcare roles would be interested in that result. So would it be nursing, health information technology, medical assisting, physician assistant, radiology? So which healthcare roles? And how would you as an MA use NCQA info or HIDUS measures? Okay, so on that note, let me expand this. I am actually on the NCQA website, and out here are programs. Here's your HIDUS. So it's a very friendly, user-friendly website. So here's our HIDUS measures. Expand on this a little bit. All right, so IDIS measures and technical resources. Okay, we have effectiveness of care, the measures. So this is a very good assignment. Again, put some time into it, do some thinking. Anybody has any questions, let me know.